So today we're going to run through some hospital pharmacy questions for hospital pharmacists working within the United Kingdom. So there are several questions asked on the Micropharm Instagram page, and I want to answer some of these today. Some people are asking the question of the main differences between hospital and community pharmacy. There are several different differences. Mainly you'd be working on a ward, and the majority of your time would be working on a ward as a junior pharmacist in hospital, which is completely different to the community pharmacy setting. You'll be facing a lot of patients that are acutely unwell, and one thing that I found quite difficult to grasp is having a good understanding of hematological data. So having a good understanding of what different blood results mean and how they impact the use of your medication. The reason why I found this so difficult is because you do not have access to this as a community pharmacist. So it does take a while to understand and appreciate the different aspects of a patient's blood results and how they can impact their medication. You will be required to conduct a medication reconciliation with a patient. So there you have to discuss all the medications that a patient's on and what they're taking it for and why they've come into hospital. This is very different, or can be considered very different to community pharmacy, where you only deal with cases where you're responding to symptoms. Rather, this is a much more holistic and time-consuming approach. One question that I received, which was particularly important, was how to stop worrying about whether or not you have made the correct clinical interventions. The reason why this is so important is this is something that you will face throughout your entire career. When I first started as a specialist antimicrobial pharmacist, I had the responsibility of giving advice to junior doctors and different healthcare professionals about different antimicrobials, and I found this very daunting at the start. The way in which you can approach this is, first of all, ensure that you have the correct training before practicing as a pharmacist. Once you have the appropriate training and you're practicing as a pharmacist, make sure you pick out any complex queries, and then you can discuss these complex queries with any senior pharmacists or your line manager and see if you gave the appropriate advice. This makes it very easy and manageable for your line manager to discuss these queries, because it's one query picked from several queries that you may deal with throughout the day. And then you can see that you're giving the correct advice for these complex queries, and this makes me feel a lot easier about any other queries that I deal with throughout the day. Knowing that I gave the correct advice or receiving feedback on any advice that I could have given in its place allows me to face that situation a lot stronger and be much more confident when I face those kind of queries again. Another question I was asked was whether or not I enjoy my role and whether or not I can see myself working in this role long term within hospital pharmacy. This is a question that I took a lot of time to consider, and I do see myself working as a hospital pharmacist long term. I can also see myself working within the antimicrobial specialty long term, because there's so many different aspects of the role and you can never feel like you've truly mastered that role. So in short, I do see myself working in hospital pharmacy long term, and I also do see myself working within my current specialty long term. I hope you found this video useful. If you did find it useful, be sure to subscribe and drop a like, and I will be making more videos answering questions that people may have about hospital pharmacy.